Tell us exactly how this will contribute from your point of view and from your experience to Tanzania fertility care.
I must say the 3 months I spent in India with my colleagues who are here today was very, very useful because we had this opportunity to be trained to help women who are infertile. Being a gynecologist, I was even more privileged because at least I had an idea of how best you can stimulate patients before you take them for IVF. And the way it was structured, like you've seen in the video, we had an opportunity to learn the anatomy and physiology. That was the first part. That was more of a theory part. And the second part, which took longer, and I think the way it was structured, that was the best thing that has been done to us, was the fact that we spent more than 10 weeks in embryology lab purely to get hands-on for conventional IVF, handling of the sperms, and also dealing with the troubleshooting, because in the end I came to realize that if you don't know how to deal with the troubleshooting for embryology lab, then you have nobody to help you. So the way the teachers that were dedicated to teachers, the way they were trying to impart that knowledge, I think it was very, very, very fruitful. And in the end, I remember the last time that we were just about to leave, we were given an opportunity to deal with several live cases. And I can tell you, the feeling I had the first time I saw the first embryo that, say, I made maybe from the eggs that we did, it was a very, very, very good feeling. And the fact that we had another opportunity of getting online training, that was the registration that was done through the ASRIM. And again, the quality control and quality assurance, which I think is the most important part of fertility treatment, was also covered in this aspect of the training. So it was a very good training program.
So you recommend it for every young doctor who want to be specialized in fertility?
Yeah. I think because we have a very huge need in Africa, 3 months training is an ideal training program that anyone who thinks that can venture in the field of infertility should be able to be a part. So I would recommend to anyone who would love to be part of a successful story that Merck have decided to take, to apply for these kinds of training. And I think we'll definitely be able to help our communities, and especially women who are suffering from infertility.
Thank you very much, Dr. Nicholas. Thank you. My question now will go to Honorable Minister of Health of Chad. And of course, I know that you're working very closely with Her Excellency First Lady of Chad, and she's gracefully going to take Merck More Than a Mother as an ambassador and a champion to Chad. And of course, your role will be also to identify candidates for training, not only for fertility, but also for oncology and cancer care. So can you tell us about your expectation or how you see this will contribute and how you will implement it and how fast?
Merci, professeur Rasha et chers consoeurs, parce que je suis pharmacienne aussi. Je suis très émue, il faut le dire. Je ne savais pas que ce jour-là, à l'Union africaine, quand vous vous êtes approché de la première dame du Tchad pour déjà dire bonjour et ensuite présenter la fondation Merck. Je ne savais pas que derrière tout ça, il y avait une si belle histoire qui s'écrivait. Je voudrais profiter du micro qui m'est offert pour saluer les premières dames d'Afrique. Chères premières dames, vous avez commencé une histoire qui est en train de révolutionner en fait toute l'histoire du continent. Et permettez que je vous fasse une confidence. On était à l'Assemblée générale des Nations Unies, la 72e session, quand le président Alpha Condé, président en exercice de l'Union africaine, a pris la parole. Il présidait une séance et que chaque champion, chaque chef d'État devait prendre la parole pour défendre une cause. J'étais émerveillée parce que ce n'était pas des simples déclarations politiques comme on les faisait hier, mais vous sentiez en ces leaders africains l'engagement qui augure d'un nouvel avenir de l'Afrique. Et tous unanimes savent que eux, en première ligne, avec à côté leur première dame, peuvent faire bouger les lignes. Et la question des ressources humaines, je voudrais, Rasha, saluer le fait que la Fondation Merck mette un accent particulier sur les ressources humaines. Parce que toute action pérenne ne peut l'être que si nous garantissons les ressources humaines. On aura beau inventer les machines, mais toute action noble et pérenne se repose sur les ressources humaines. À ce propos, je voudrais d'ores et déjà vous dire que nous avons besoin d'être renforcer nos capacités, notamment dans la question de l'infertilité. Je ne reviens pas sur les exemples et la pertinence de l'action de Merck, parce que toutes les vidéos que nous avons vues ici ont été parlantes et ne peuvent laisser personne insensible. Et nous avons déjà un partenariat entre la Fondation Grand Cœur de Son Excellence la Première Dame du Tchad et le ministère de la Santé publique. La Première Dame du Tchad a des initiatives, mais soyez rassurés que c'est en étroite collaboration que tout ce qui concerne la santé se fait en concertation avec le ministère de la Santé. Et je suis tout à fait à l'aise puisque ça fait des années que j'ai le privilège et la chance de côtoyer la Première Dame qui rêve pour le Tchad, mais rêve aussi pour tout le continent africain. Merck, c'est le début d'une longue histoire qui s'écrit entre tous nos pays. Je ne parlerai pas du Tchad seulement, parce que l'union fait la force. Et quand nous regardons nos premières dames, comment, malgré leur agenda chargé, se préoccupent de ces questions, notamment la question de la fertilité aujourd'hui. J'avoue que c'était une question qu'on n'osait pas évoquer en public. Mais aujourd'hui, avec Merck, le fait de l'évoquer en public va résoudre beaucoup de problèmes et rétablir les femmes qui n'ont pas la chance d'avoir des enfants dans leur dignité, parce que c'est bien de ça qu'il s'agit. Je terminerai en vous racontant une petite histoire. Dans l'avion, l'hôtesse m'offre une rose et j'ai mis dans mon sac, j'aime les fleurs. Arrivée à destination, quand je l'ai sortie, elle était toute fanée. J'ai eu un pincement au cœur, mais on m'a appris qu'on peut mettre un peu d'eau et du sucre et j'ai mis la rose dedans. Le matin, quand je me suis réveillée, les pétales se sont réouvertes. Et c'est un peu ça que Merck va faire avec le continent africain pour que chaque femme soit plus qu'une mère. Et merci encore de nous avoir associés à ce forum. Merci beaucoup.
Thank you very much. It's a really touching story. Thank you very, very much. And we will be the continuation of a long history of 350 years of Merck, and we will make history together in our countries, in our beautiful, beloved Africa. So my question will go now to the Minister of Health of Central African Republic. You told me during our meeting 2 days ago that you would like to have men also a champion and ambassadors for Merck More Than a Mother, because they actually feel passionate about it and they can encourage their fellow men to pursue suit. So, and also you told me about the program of Cancer Access Program and the Oncology Fellowship Program and how this will help very much in Central African Republic. Can you please elaborate for our audience, because they were not with us, so I want you to tell them.
Merci beaucoup, Dr. Rasha, avec tout le respect que j'ai pour et l'admiration que j'ai pour vous, pour votre engagement, pour votre passion. Avant de répondre à vos questions, j'aimerais d'abord dire quelque chose au nom du gouvernement, du président de la République, le professeur Faustin Archange Touadéra, que je représente ici en tant que membre du gouvernement, pour dire un grand merci. Un grand merci à la Fondation Merck, parce que le partenariat qui s'est établi entre la Fondation Cri du Cœur de Madame Brigitte Touadéra et Merck, pour nous, est une aubaine. C'est un don. C'est vraiment une... elle vient à point nommé. Promouvoir la femme, protéger la femme et protéger l'enfant est la première priorité du gouvernement. Il y a même un ministère qui est érigé pour cela, en République centrafricaine. Mon ministère est le ministère de la Santé et de la Population. Donc c'est pour vous dire que l'importance que revêt ce partenariat pour nous, en République centrafricaine. Nous comptons beaucoup dessus et vous pouvez compter sur moi en tant que ministre de la Santé. Vous comptez sur toute ma coopération parce que nous allons utiliser ce partenariat comme le levier de notre action. Le deuxième point est vraiment rejoindre ma sœur du Tchad pour rendre un vibrant hommage aux premières dames que je connais très bien, puisque je viens de l'ONU-SIDA. Je vais maintenant répondre à vos questions. La première concerne les hommes. À l'ONU-SIDA, d'où je viens, c'est moi, je fais partie de ceux, sous l'impulsion du directeur exécutif, M. Michel Sidivé, a engagé une grande initiative sur l'implication des hommes dans la lutte contre le sida. Et cette action était dans la perspective d'impliquer les hommes de façon générale dans la santé. Et pour moi, en retrouvant ce programme, je me suis dit, voilà, je suis très bien arrivé pour moi. C'est Dieu qui m'a donné cette occasion pour continuer mon action que j'ai commencé à l'ONU-SIDA. Et ma contribution va être de mobiliser les hommes. Mobiliser les hommes pour eux-mêmes, parce que vous savez, le vrai problème qu'on voit aujourd'hui dans le problème d'infertilité est le miroir d'un problème plus grand au-delà de l'infertilité. Les hommes ne prennent pas soin de leur santé déjà. Ils ne prennent pas soin de leur santé déjà. Et c'est ça qui a un impact sur tout, même sur le sida. Il faut les mobiliser, il faut les sensibiliser pour qu'ils prennent soin de leur santé, non seulement en tant que personne, mais aussi pour qu'ils jouent leur rôle de leader, parce qu'ils sont leaders. Pour qu'ils jouent leur rôle de parents, pour qu'ils jouent leur rôle de partenaires. Et c'est là que, dans la lutte contre la fertilité, ils ont un rôle à jouer. Donc, vous pouvez compter sur moi là-dessus. Et on va en profiter avec Mme Brigitte Touadéra pour que cet aspect devienne un des piliers de notre partenariat. Concernant le cancer, d'abord, merci beaucoup, parce que, comme vous le savez, notre pays est en train de s'efforcer pour sortir d'un grand conflit. Le système de santé est par terre. Et cet appui arrive dans ce contexte. Pour nous, ce partenariat vient contribuer à la revitalisation du système de santé. Et par rapport au cancer, le cancer était encore plus inexistant presque. Inexistant. On a un registre, on a un cancérologue qui vient d'être formé. Voyez, et il y a tout à faire. On doit développer un programme contre le cancer. Donc ce partenariat pour nous va nous permettre d'avoir un programme national sur le cancer, d'avoir les ressources, et nous comptons beaucoup sur vous pour vraiment avoir un programme comme celui-ci, parce que je suis persuadé qu'il y a beaucoup de femmes qui meurent de cancer. On a à peu près 36%, entre 2000 et 2012, on a recensé 2015 cas de cancer, dont 36% sont des cancers gynécologiques. Et donc la prise en charge est presque nulle. Donc vraiment, encore une fois, merci beaucoup et rendez-vous à Bangui pour que nous puissions continuer, porter la campagne à un niveau plus élevé. Je vous remercie.
Thank you very, very much. We'll be there soon. Now, my question will go to Honorable Minister of Health and of Republic of the Gambia, Honorable Safi Sisai. Can you please tell us, of course, I know that you are doing with Her Excellency First Lady a big campaign about infertility and also establishing a radio FM to raise awareness about health topics. And of course, Ministry of Health will have a role in that, and also role of selecting the candidates who will be the trainee, because without the fertility specialist and the oncologist in the country, I mean, all this will not, of course, be achieved. Of course, I know that this will take time, at least 1 year, but after a year and then followed by a year and a year, you will have a very black platform of specialists and experts, and you don't need any experts from abroad. So how can you will take this forward and you know, identify the right candidates who are committed to make a difference and change the landscape of the healthcare in Gambia?
Well, the question that you have raised regarding the issue of infertility in the Gambia is just the same thing that runs across all of Africa. The magnitude in which we see things might be different from country to country, but generally, it's all the same. So they suffer in silence as a result. And it is also equally a taboo to link infertility to African men, because as far as they are concerned, they're functional, everything is fine with them. And it goes beyond that. The lack of awareness of infertility and how it can be overcome or how it can be controlled runs a long way in our women's life. Some who suffer from that. But it hasn't come to the point where, like we've seen in that small film that was given out, where the husband has to cut his wife's hands off for not having a child, or the extent of bringing a woman to your marital home because your wife hasn't conceived. We haven't gone to that stage, even though there are women who suffer silently as a result of that. The same also goes for the treatment of cancer. There's almost a total absence of cancer facilities in the Gambia, almost a total absence. Besides the fact that we've introduced this HPV vaccine, that's the human papilloma vaccine, which targets girls from 9 years to 15 years, and the screening of cervical cancer, there's nothing. Yeah. Sometimes people don't know they have the cancer until it goes to a stage which is very late.
And there is no oncologist, or how many oncologists?
No,
oncologists.
there's none.
Okay, so it will be a great opportunity to have
exactly,
candidates for
to have
oncology.
Merck with us.
Yes,
Yeah.
yes.
We have a university
Yes.
that churns out doctors,
Yes,
but
but
no
the oncologist
specialties.
is very sophisticated
Yeah,
training.
there's no
needs to be,
specialty. It's just general
Yes,
doctors,
yes.
medical doctors. So Merck coming in to collaborate with the Gambia will be an advantage to us.
It's great.
Yeah,
Yeah.
because it will mean that the issue of cancers and infertility will be adequately addressed.
Yes. And how easy do you see that identifying the candidates for the training? I mean, can it be done
Yes,
quickly?
it can
or
be done.
Yes,
It can be done because we
Yes.
have already people who are qualified as medical doctors.
Okay.
All they need to do is specialize
Okay.
in
So,
these special areas.
You will send me the list of the candidates as soon as you
Yes,
come back. Great.
as soon
great.
as we
yes,
do that,
yes,
yeah.
Yes, fantastic.
Yeah, we
Yeah,
can.
it's great. So we can start our mission soon.
Inshallah.
Yes, inshallah.
Yeah.
So thank you very much.
Thank
You
you.
finished. Thank you very, very much. And I'm sure that we will be soon also making another history chapter in Gambia, along with the Ministry of Health and your Excellency, Her Excellency First Lady of Gambia. So my question will go now to Deputy Minister of Health of Namibia, Honorable Giulietta. And I know that you joined the campaign Merck More Than a Mother, and also you were very active to send us the candidates for oncology training, which is already 2 of them has joined, one in India and one in University of Alexandria for 3 years clinical oncology, and the other one for medical oncology training. So, and also the one candidate for fertility specialist. So just tell us an idea. Of course, you also have done great achievement for finding the wonderful lady, Honorable Margaret, the chairperson of the National Assembly of Namibia, and a great example for women empowerment to be just champion of Merck More Than a Mother. So I want you to elaborate on that for our audience.
Thank you very much. First of all, I have to thank Sandra because it was during a meeting of Merck as a sales department that visited my ministry that I met Sandra. Immediately she said no, because when I started talking about the passion for us of issues of infertility, she recommended Rasha. And after 2 emails, Rasha, as you know, her energy and everything started working. And in no time, we met early this year. And by July, we have 2 students identified already for the scholarship. That was actually fast as possible. And then the issue of the chairperson of the National Council as our ambassador is not the fact that our First Lady doesn't want to become part and parcel of the initiative, but we believe in diversifying in our approaches towards what we want to achieve. So we say there is a number of First Ladies as per Rasha's discussion. No, the First Lady of Chad, the First Lady. Then we said no. The Namibian way, we have to look at another person who will bring a total different flavor within the discussions, and then we say that we need a legislator, somebody who will push the laws that we doesn't have in order for us to make an impact. So, and when the committee discussed the issue and recommended Honorable Mensa Williams, she immediately just joined the crew, and we started working on already launching, but unfortunately the launching could not take place. But for us, Merck Foundation and the More Than a Mother initiative, it's a holistic approach towards women health. We look at it with a critical eye that we would like to advance women in general, their health in general. So it's why I want to use Merck, the foundation, and the More Than a Mother as a vehicle that will transform the concept of infertility in our community, and also the healthcare provision to women in our country in terms of access to oncological services, especially the screening, the treatment, at a very low level before it becomes a disease or curative, before it moves to the curative department. So the 3 things that my intervention will base on is basically the legislations, laws that we need to put in place, because in every country we know if you do not have laws for human tissue, how do you get the sperms to be stored or even to be implanted to another person? So we must make sure that all our laws, it's at par and it's talking to the needs of the infertility and women health. Then the primary intervention, I know that it's a long way to train oncologists, to train doctors in fertility issues, to train embryologists. It's a long way. But there are things, the low fruits that we can catch hanging. The first one is making sure that we integrate our services. When a young woman age 18 comes to a clinic for contraceptives, the first question that you have to ask, did you have a pap smear? It's not what we are doing. Somebody comes for a contraceptives and we just give the injection or whatever and the patients go. Let us integrate these issues within our healthcare facilities so that we can give the comprehensive and a package to every young woman who is a potential to be infertility or to be getting cancer in one or another way. When we change our mind in that approach, I think we can make an impact. The other thing is that equip our health workers with information. I'm telling you that we registered nurses, I'm a registered nurse by profession, and that's my first degree. When somebody comes, we have so different information. What is infertility? What is the cause? Somebody will become judgmental, they will start discouraging people, and they will talk about, some of them are so Christian these days that they start praying immediately when you talk about infertility. I'm thinking that Merck, we can have a comprehensive package of training our health workers on a consistent message on infertility and oncological problem that we can convey within our facility so that every health worker can speak the same language immediately. It doesn't need a lot of cost. It doesn't need HS to be trained. It's a course maybe of a 1 week or something that what is infertility? What is the causes of infertility? How can we prevent infertility? So that's the second thing. Then the other thing that we can do is that there is nothing for people without people. If you think that you can succeed without involving the people that are affected, you are doomed to fail. So it's very important that we can coordinate our members in the communities, the patients, the clients that we are dealing with, and give them information on the various ways of infertility. Let this project become a community-based project. Let it not end at the speaker's office, let it not end at the ministry's office. It should be able to go out to the people and they can have a voice and actually be more vocal about this issue. Then the last one, the interventions. There are very cost-effective and easy interventions that we can deal with. While we are waiting for the sophisticated labs and whatever, let's start and work so much, do more with little what we are having. Let us not wait for Merck one day to come and put up a lab in Namibia. Let us try to encourage people to avoid A, B, C, D, in order for them not to become infertile, or to, if there is a surgical intervention that can be done, let us do this, because IVF is the last resort. It's not the beginning of infertility. So let us make sure that we are actually helping our people. The last intervention, actually, that is a secondary intervention, is what we are talking here about. The issue of the labs, the issue of training of the medical personnel, the infrastructures, and very, very important, very secondary and very important is actually involving, I know health is a human right. We know that the Ministry of Health is a custodian of healthcare, but it's also very important that we cannot reach every corner. Let us utilize resources that is already on the ground in order to enhance and provide care for our people. Thank you very much.
Wow, well said. It's great strategy of implementation and execution, and actually we can take this forward to other countries with your guidance and leadership. Thank you very much, Honorable Julieta. I know that you are going to make it. After I called her the first time, in 2 weeks I had everything I want sent to me, and we started. It was the fastest, actually, implementation ever. Thank you very, very much. I would like also to give my second question to Honorable Engelbert, the Deputy Minister of Health of Tanzania. And of course, I know that we, with Dr. Nicholas, went to meet Her Excellency Vice President, Dr. Samia, and she was very eager to be ambassador of Merck More Than a Mother, as also a woman who's been involved in many projects about women empowerment. She's also the UN ambassador for women empowerment. And she wanted to invite us to launch the Merck More Than a Mother in Tanzania, but she couldn't come this time because she has another engagement by the president, and she actually delegated yourself to represent also her. So I would like to know from you what you think about the Merck More Than a Mother and the oncology training and fellowship we are offering also for candidates from Tanzania, and how you will take this through the Ministry of Health and Minister of Health.
Thank you very much for the invitation. And before I start, I would like to convey the greetings from the Vice President of United Republic of Tanzania. She really wanted to be here, but due to other engagements, she asked me to represent her. So she passes on her greetings. I know you met her earlier this year. But I would also like to acknowledge the support of Merck Foundation to Tanzania through the good work that it's doing, the training of oncologists, on the video here, we saw three young Tanzanian doctors being trained on the areas of infertility. And I think this is the kind of partnership that we are looking for, the government and the private sector. We have a very good law and policy on the public-private partnership. And I think this is one of the areas that we encourage. So as a representative of the government, we do really appreciate this kind of support, and we pledge that we are going to use the newly trained professions to spread the knowledge and the skills that have learned on the areas of oncology, infertility, and also cardiology. And we, as the government, we are keen. We are keen to make sure that these services are made available to the greater majority of people in Tanzania. And it's in line with our own policies that we currently have. Right now, our focus is to make sure that basic medical services and medicines are available to the people. But also, in line with that, we want to reduce significantly number of referrals abroad. So we're currently working on enhancing cancer services, oncology services in Tanzania. One of the areas that we are working on is on the areas of training. We're training our local doctors, but also make sure that the facilities in Tanzania are equipped with the state-of-the-art equipment. We are now installing the LINAC machines at the Ocean Road Cancer Institute, and next year we plan to buy the PET scan, so that at least most of the Tanzanians are now able to access those services locally. But you also are looking at to equip the other referral hospitals within the country to be able to provide chemotherapy and radiation therapy to patients. So all these are some of the initiatives that we are putting in the country to ensure that we are cutting the number of patients that are going abroad, but also making the services available and accessible to the common people who are not able to travel abroad for these medical services. And lastly, I would like to assure you, the Merck Foundation and you in person, that the country is committed under the stewardship of the Vice President and we in the Ministry of Health to make sure that this more than a mother initiative it takes root in the country, and we utilize the well-trained profession that we have in the country in order to sow the seeds for furtherance of these services in the country.
Thank you very Thank you very much, and we are ready to come to Tanzania very soon. So my question will go to President of International Federation of Gynecologists and Obstetrics, FIGO, Professor Burandari. So we met first time in India during the International Federation of Fertility Society World Summit. And from that moment, you are already joining us and committed to two things. You told me also you are interested on gynecology oncologist training and other things, and also Merck More Than a Mother and empowering, and improving access to fertility care. As we said, fertility is not only IVF, it's also fertility intervention and simple intervention, which we can actually train many gynecologists to do it and to improve the landscape of fertility care across Africa and Asia. So I would like to know your views, to share it with all the audience, being the president of the biggest society, almost how many? 130 countries. So if you need anything, you go to Professor Burandari. He have access to all the countries across the world.
Thank you, Rasha, for inviting FIGO to be at this panel. And just to give you one line on what FIGO is the International Federation of Obstetricians and Gynecologists. And we have 130 societies which are members of FIGO. Egypt is one of them, UK is another, USA, India. These are all countries which are part of FIGO's gynecology and obstetrician. when I look at the whole perspective regarding various countries that we need to look into and going into, I think we need to strengthen the on-the-ground obstetricians and gynecologists. Unless we strengthen them, we are not going to deliver the whatever that we need to do, because we won't have the infrastructure, the personnel who are obstetrician gynecologists who we need to for infertility treatment, whether it is oncology or whatever that needs to be done. We need to strengthen them, and that is something which FIGO is committed to, and we are looking for partners who would help us to strengthen these obstetricians and gynecologists in various countries. Talking of the cancer cervix, which is one of the major issues as far as all the African countries are concerned, and the late diagnosis and so on. And the loss of life as far as cancer cervix is concerned is unacceptable, because it is a preventable disease. And we have vaccination available by which you can prevent the disease. And it's time that we start off with all the ministers and first ladies that are here, make sure that we start from the schools to make sure that the 9, 10, 11-year girls are vaccinated, so that we prevent the HPV infection, to make sure that cancer cervix does not occur. We have been able to reduce maternal mortality in a large scale in all over the world, barring few countries. Most of the places we have been able to reduce the maternal mortality. But we are going to lose all those mothers saved by reducing maternal mortality dying from cancer cervix, unless we really look at it as a holistic manner, that we have to look at the women's health and reproductive rights as their fundamental right for women. And unless we support all that, it's not going to happen as a holistic measure that we need to do. Talking about the infertility and IVF, and I felt very elated when somebody in the last panel said that IVF is not end all of everything. Fertility treatment, there are a lot of things that need to be looked into before. IVF is the last resort. There are so many things that we need to general advice to a couple itself may solve the problem of infertility in many of the couples. So that is something which we really need to look at, and not think about the hi-fi IVF for each and every country that needs, maybe one center is good enough for those which cannot be treated by other methodologies, and which is something which is very, very important that needs to be done. We have been working on a fistula project in the African countries, training doctors to do fistula surgeries, and not even that. Now today we have affiliation with FIGO, so that any patient who is needing fistula surgery, the entire kit is given free by FIGO for them to be operated in various countries that we need to do. And then the 10 committees and working groups that we have, we are in the process of starting Center of Excellences from FIGO all over the world, in various, like in infertility, in everywhere, so that people can come there and get trained, and they will be FIGO certified, recognized centers, which will give a FIGO certification at the end of it that they have been trained and working on it in those particular areas. And with Merck for Mothers, which we've been doing superb work, and I must congratulate you, Rasha, from all angles. It's not only infertility, oncology, for everywhere, it's a holistic, for women's health, the way you have put in your effort, they're commendable, and I can assure you, FIGO will be 100% behind you for whatever that you need. You're welcome to just talk to us, and we will make sure that we will be available for you for that. Thank you very much.
Thank you very, very much. And I assure you, I will coordinate all this to you. So we can see also regarding the fistula, free kit for training, for treatment, for all these things. And we will make a very big network, and we will be partner, long-term partner, definitely. So my question will go to Honorable Vice Chancellor of Maharashtra University, Professor Dilip. We met 2 years ago, and we started our partnership, and we are doing a lot of training in India, in your universities, across your universities, oncology, and we're doing diabetes, and we're sending doctors from Africa to be trained as a oncology fellowship in Tata Memorial Hospital and your universities. So it will be great, of course, that you can elaborate on our partnership and how the role of India academia and Asian academia, knowing that we have African Asian luminary today, can contribute definitely and very significantly to building capacity and healthcare capacity in Africa.
Yes, thank you, Rasha. Already you know that the Maharashtra University of Health Science started MOU with you. And we are promoting all the trainees for that. We too are your, thank you to Rasha that she has already taken a part in diabetes, hypertension, then oncology and everything, and we have got this MOU about training also. I had a word with Dr. Kailash also about the Tata Memorial, and he has given, because with them also we have got the understanding about the training person. And you must have got the data that almost up till now 6 nurses from different African countries, Sub-Saharan Asia, they have been trained already. Then 5 unit oncologists has also been trained from them. And we see too in the future also, from our side also, the faculties, what you will be promoting, that they will be also trained, and their services will be also provided in the exchange program also. And the best thing is that you are also promoting in the other part of the student, undergraduate, postgraduate also, about this arousal, about all the various factors which you are taking under care. And it's very good that the Maharashtra University of Health Science will continue to promote this MOU. Thank you very much. And I think all this August gathering will agree that Rasha has taken every part in every aspect. She needs an applause for this. Thank you very much.
Very much. It's really a very valuable partnership, and I believe very much in the role of India to contribute to Africa, and the partnership between Asia and Africa is undeniable. I would like to give my question now to Vice President of Africa Fertility Society, Professor James Ulalalopu. And of course, he will tell you also about the International Federation of Fertility Societies meeting. Summit will be in Uganda in Kampala, and his role also for the training of embryologists, because embryologists and fertility specialists, because I believe this is the key factor to change the fertility care landscape in Africa, is having these people, having this representative, having these experts across Africa to raise awareness, prevention, management, and everything.
Thank you, Rasha, and may I also thank fellow panelists for the input they have made this morning. And I would like to have about 3 points to summarize the panel discussion this morning. First of all, on behalf of the African Fertility Society, we have worked hard over the last 2 years or so to put the African voice out in the global stage, to put the voice of African women out within the region itself, and then to have this embedded within the national structures, the national government and healthcare systems. And I think we will continue to do that collaboratively with our partners, Merck Foundation, the International Federation of Fertility Society, and the WHO. And moving beyond today's and this conference, we will be holding a collaborative meeting in Kampala in March 2018, working collaboratively with the International Federation of Fertility Society, my own society, the African Fertility Society, and the parent Uganda Fertility Society. So all of you are welcome to that meeting. And now let me address issues specific to provision of care, access, and capacity building. And I want to compliment my fellow panelists for going through what they are able to do in their own countries and the plans for the future. And I want to compliment that from the point of view that implementation process needs auditing and evaluation. And that will generate data and research to be able to measure the amount of success one is undertaking and going forward. And I think in that regard, we would then be able to evaluate how much money we are putting into the project, how much training we are putting into the project, and how much advocacy is needed so that we can be able to involve a multi-stakeholder engagement into the project. Now, let me address specifically the issue of embryology. Embryology is dear to the heart of and central to the delivery of IVF services, because the embryologist is the only person who can answer that fundamental question: are these gametes, the sperm and egg, adequate and satisfactory? Has fertilization taken place, yes or no? Can we transfer this embryo into the woman or store them? The only person who can be able to answer those key fundamental questions is the embryologist. In that regard, the training, Nicholas and his team, plus all those who are going to have further training via Merck and the American Society for Reproductive Medicine, is going to complement and enhance this input. And the beneficiary is going to be reducing barrier to treatment, enhancing capacity at the national level. Thank you very much.